Hi, my name is Salma Jenis, and today I will be going over the Jones fracture, specifically implementing it in a physical therapy case. In order to evaluate my patient, I will be taking a SOAP note. So the subjective portion of the SOAP note is what the patient is reporting to be their condition. It's valuable to take into consideration. Objective is a measurable observation as well as test results. Assessment is the analysis and conclusion of the subjective and objective portion. This is where you come to as a conclusion of what the situation is. And plan is addressing the goals of treatment and what methods will be used to achieve those goals. My patient is a 20-year-old ultimate frisbee player named Nathan Mora. Nathan has been taking an ultimate frisbee course at his college, and when playing earlier this week, he abruptly landed on the side of his foot after jumping. By the end of the week, he started complaining of pain and difficulty in walking. The pain and difficulty in walking are specifically oriented on the right outer side of his foot. The Jones fracture is on the 5th metatarsal of the foot. So you have the 1, 2, 3, 4, 5, and it is right in the middle of the metatarsal that connects the pinky toe to the rest of the foot. It usually occurs from impact to the 5th metatarsal. Again, a strong impact will cause the fracture. It can be on the outside of the foot or the bottom of the foot. Simple acts of running will also cause micro tears that can lead to fractures in long term. Subjective. So the patient is a 20-year-old male concerned with his right foot. After a frisbee class, he complained of pain and trouble walking in the days following the class. Pain and swelling in the outer right foot is what he reported. He also reported difficulty in bearing weight, and he reported to have some bruising. Objective. So in a foot examination, it was reported to have tenderness to touch. There was a note of discoloration, note in swelling. Abnormal gait was noted as well when walking into the clinic. There's pain at dorsiflexion and plantar flexion. X-rays and additional imaging show that there is in fact a tear in the 5th metatarsal. Based on the subjective and objective note, the 5th metatarsal connecting the foot to the small toe is fractured based on the areas that are in pain in certain movement, and the large impact of landing after a jump fractured the bone. Also, the X-rays clearly show that there was a fracture. So the diagnosis is a Jones fracture, the 5th metatarsal fracture. So therapy will be continued after surgery. All of these notes are before surgery because in order to treat the foot correctly and the patient correctly, you will need to have gone through the surgery that will correct the fracture. The goals post-surgery are to reduce the pain and to maintain range of motion as well as strength from being in the boot or the cast that is assigned to them after their surgery. So goals and plan would be RICE. Then we have the orthopedic boot, stretching, and strengthening exercises. The patient will be on a RICE protocol, so that means that they will rest their foot will not be weight bearing, ice for the swelling to go down, compression with the boot that they will be wearing, and they will elevate their foot to also reduce swelling post-surgery. The orthopedic boot will be used for a majority of the 6 to 8 weeks that this treatment will last post-surgery. They will not bear weight. They may also require the use of crutches in the earlier phases of their recovery. Healthy stress on the bone will be introduced so that they can build a stronger bone. And gait training, which you will lead with your injured foot while the crutches balance the weight and then pass with your strong foot. This is just crutches training that will be necessary for the earlier phases of the therapy. So the stretching protocol is designed so that the patient retains the range of motion they had before surgery, and so that way when they do get out of that boot after 6 to 8 weeks, they aren't seeing any major effects to their gait. They have the dorsiflexion stretch, which is seen here, and you're pointing your toe towards your body while laying out flat with your leg extended. So that would be 1, 2, 3. So there's 10 repetitions, and you do 3 sets of those on your right foot. On the plantar flexion, you will be pointing your toe away from yourself. Again, laying down on a mat, on the floor. 1, 2, 3. So 10 repetitions of 3 sets. Inversion, you're pointing your toe towards your body. Inwards towards your body, and then you come back to this neutral position that this foot looks like right here. So it comes in, and then it comes to the neutral position, comes in, neutral position. And that's 10 repetitions of 3 sets. And then eversion, you're pointing your foot away out of your body. That's 1, 2, 3. So 10 repetitions of those for 3 sets. This stretching protocol is designed for the earlier weeks following the operation, so that there's not a big strain on the operated foot, but it also still maintains that range of motion that the patient originally had. The patient will be in a boot following the surgery. So some of the side effects of wearing a boot will be that those muscles that do usually weight bear will not be and may weaken. So when the boot does come off, the gait may see some change or discomfort. So in order to offset some of the impact, there are some exercises that I have to strengthen the muscles in the ankle and the calves and the quads. We have towel toe curls. So we have a towel laying out flat. You lay out your foot and you curl the towel towards your foot, and then release back to neutral. Curl the towel towards your foot and then release back to neutral. So each curl and release is 1 repetition. So you have 10 repetitions for 3 sets. You have the quad sets. So you put a towel underneath the calf or closer to under the knee, and while you're laying flat, you have a contraction here in the calf to dorsiflex like we did before with the stretch. But in this one, we want a strong contraction that holds for 20 seconds. So while you have your foot in this position, you're holding for 20 seconds. So 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, and so on. So 20 seconds, 1 contraction of 20 seconds is 10 repetitions for 3 sets. We have a gluteal set. So while laying flat, you will contract the gluteal group muscles so that the pelvis lifts just a tad bit. We don't want an awful hard contraction. We just want something so that this group is being worked. This one is a 5-second hold for 10 repetitions. So 1 contraction and then release is 1. When you contract, you hold for 5 seconds and then release. That's 1. Contract 5 seconds, release. That's 2. For 10 repetitions for 3 sets. We have foam balances so that the ankle, this is a little further in the recovery, but it's important to remember that you use a lot of your ankle muscles to maintain a balance. While keeping safety in mind, you will have a chair or a table or something to support yourself while you're doing this exercise. So you step on with the foot that has been in the boot, and while lifting the stronger leg so that you are balancing on the rehabilitating leg. So you balance for 5 seconds on this 1 foot while on a foam, while having a table or chair nearby. Hold that for 5 seconds. support yourself again with your leg once those 5 seconds are over, and then you do a repetition of 10 for a set of 3. This protocol will hopefully avoid any gait issues that may occur from being in a boot. Nathan came in complaining about a pain in his right foot. After testing, we came to the conclusion that he had a 5th metatarsal fracture. He underwent surgery and is now in a 6 to 8 week treatment plan for rehabilitation of his right foot. The progress will be seen in adding weight to the exercises he completes. Later stages will also go into evaluating what his needs are for the boot and the crutches as he strengthens his leg and as the bone heals. With this initial therapy plan and modifications that will come as he starts to progress, we hope to have Nathan walking healthy and returning to his normal activities very soon. So thank you for watching my video, and here are my sources